A good candidate for a breast lift is women who had few children. After breastfeeding, they discover that their breasts start to look slightly empty. It's usually because during pregnancy, their breasts get bigger, so the skin stretch. And then when it happens more than once, they lose their skin elasticity. And they think, a lot of them, that actually they want a breast augmentation. But when you examine them, you realize they actually have a good volume of breast, but unfortunately the skin become very loose. They are good candidates for a breast lift, and they will benefit from this operation. The breast uplift operation is an operation done under general anesthetic. It lasted between 1.5 hours to 2.5 hours. During the operation, the scar will depend on the amount of skin we need to remove. Some of the scar could be only around the nipple, some of them could be vertical below the nipple, and sometimes it look like an inverted T shape. And all this different shape scar depend on the amount of skin I need to remove. Patient usually go home the same day, but some of them may require to stay for another day. Also, some of them may have some drains staying overnight. I usually use suture which dissolve on its own, and all my patients will wear a sport bra continuously for 6 weeks to protect the breast in their new position. This operation, I make sure that the women at least almost finish their family, because I do scar around the nipple, and sometimes it may have an effect on the breastfeeding, and I'd rather to make sure that they finish their family. The other thing, it does not happen straight after having a child. I will usually recommend them at least to have a year after their last child, so the breast have enough time to settle down, so we know the amount which need to be removed, and we get the nipple in the best position. Breast uplift is an operation which involves the breast, and any operation involves the breast do have some risk and complication. Some of them happen early on in the first day or two. Bleeding could be a risk, and if the blood stay inside the breast, it may require another visit to theatre to drain the blood. It's quite rare, I would say between 1 to 2%. Infection could happen. If infection happens, the wound may open up and it take a bit longer to heal. It's usually around the scar, and it usually requires few more dressing before it will heal. But again, it's quite rare. It is more common for women who smoke. And this is why I will encourage all my patients that they have to stop smoking 6 weeks before surgery, otherwise they have a higher risk of infection and delayed wound healing. The sensation of the nipple could be slightly less after this operation, and sometimes actually patients have more sensation, so their sensation of the nipple may slightly change. It has been reported in the literature, some women find that actually they lost their nipple completely. It's a disaster complication, but it's very rare, and in experienced hand, this is not very common. Patients do have some scar. Scar usually take up to 18 months to settle down. Once the scar settles down, you will hardly see the scar even if it is an inverted T shape. Women can go topless in the beach in the future, and people will not know that they have any operation done to themselves. It's very difficult to get both breasts symmetrical after this operation, because usually women, when they lose quite a lot of skin, it may happen that one side slightly have more skin to be removed. It's quite difficult to predict what will be the size after the operation, because some of them, when they have children, they also may lose some volume of the breast, so it's very difficult to predict a size.